taking the time out of your day to be here with us for our CAS Assessor training series. This is the second in our required series for our new CAS Assessors. My name is Jody Weiner. I am the Learning and Development Specialist here at Sacramento Steps Forward. At the completion of this training series, there will be a short certification quiz. I think it's about 30 questions. It's all an automated system. You're going to get a congratulations email. There will be a user agreement, which we went over in last week's training. You'll get an automated quiz form in your email. And all this information will be given to you multiple times throughout this training series together. We do have 3 more trainings coming up, and in your thank you email will be the link to register for the upcoming training. So just some quick housekeeping. Again, if you're just joining us, my name is Jody, the Learning and Development Specialist here at Sacramento Steps Forward. Today, our training is in 2 parts. Again, it's introductory level, and today we're going to be hearing from Kai Kumatos. And again, Quinn is joining us. He was with us last week as well. Quinn, we're always happy to have both of you here with us. So HMIS, our first section is Intro to HMIS, Homeless Management Information System. Then we'll have a short break, and then we'll return with learning about how to use our ISP, which is Individualized Service Plan. Please be sure, like the notes in my head, please be sure to use the Q&A function for all of your questions. We do that specifically to make sure that we capture your questions and get to answer all of them. If you add your questions in the chat, we may miss it. Please, we love our emojis, y'all. Please feel free to use the emojis throughout and use the chat when invited to do so. You're going to see a little yellow bookmark on some of our slides throughout the training, and those are visual reminders for you that these questions may appear on the certification quiz at the end of our training series. There is no quiz at the end of this training. I want to be clear. All right, I think I hit all of it. And the most popular question, yes, you will get a copy in your thank you email to this recording as well as the presentation. And you're probably going to hear that a few times as well. And with that, we can get right into some of the agenda of what we're learning today. We're going to learn about the CAS agency and the work you get to do within the HMIS system, Homeless Management Information System. Know how and when to complete several different CAS-related assessments, and you'll get to see where some of the HMIS and CAS resources are available to you. And with that, I'm going to hand it off to Kai. Thank you again, everyone, for being here. We appreciate you, and you are so valued. All right, Kai, off to you.
Thank you so much. Thanks, Jody. Hello, everybody. As Jody said, my name is Kai Kumatos. I'm a member of the SAC Steps Forward HMIS team, as she said, the Homeless Management Information System team. That's the system we use to collect data on all of the work that folks in the Sacramento and Yolo County are doing to provide services to our homeless population. I'm the learning experience designer over there. I've been with the HMIS team for 3 years, and I've been using HMIS for over 7 years. So I've got a little bit of expertise here. So I'm happy to help walk you guys through all of the places within HMIS where you will be working, specifically as CAS assessors. Just as a reminder, Jody just mentioned it, but I want to reiterate, please remember, use that Q&A function to ask your questions. It's at the bottom of your screen. It's a great way to make sure I get the information you're looking for. And at the end of my presentation, we'll have a Q&A. I'll go through the questions that have been asked and answer them for you live, as many I can during the time we have. Okay, so next slide, please. All right. So before I start, I do want to let you know that orange flag that just came up. You're going to see that all over these videos. That is there to indicate that this topic will be part of your CAS Assessor certification quiz, which happens at the end of all of the training. So please pay specific attention to anything close to those little arrows so that you can pass your quiz on the first try. So first, we're going to start talking about the Sacramento COC Coordinated Access System Agency, which is a big phrase. So we're just going to call it the CAS Agency for short. Within HMIS, the biggest difference between CAS assessors and all the other CAS end users is that CAS assessors are granted access to this special partnership agency. In the CAS agency, you will work alongside the CAS staff and the staff at 211 to match clients with suitable shelter and permanent housing opportunities. In the CAS agency, you'll have access to different programs and assessments than you would normally have in your home agency. You can toggle between your agencies by clicking on the caret next to the agency listed underneath your name on the top right corner of the page when you're in HMIS. So as you can see in this image, we have an example of one of my test users, Callie Case Manager. Underneath her name, it says Training Agency. That's the agency she's officially with. Mine would say Sacramento Steps Forward. Yours would say whoever your organization is. But if she was ready to do some CAS assessor work, she would click on that little caret, and underneath it, there's an option to switch over to the Sacramento COC Coordinated Access System Agency. That's what you're going to need to do to get into that agency and do all of your CAS assessor work. Okay, in the CAS agency, you'll have access to those different programs as I mentioned. If you're not able to find the program or assessments that you're looking for, we highly recommend that you first check that top corner to make sure you're in the right agency. 9 times out of 10, that's the problem. To complete any CAS referrals for your clients, as I said, you'll need to be in that agency, and your client will need to be enrolled in the Coordinated Access System program. So there is a program in that agency that all clients that are using the CAS system have to be enrolled in. And once you're in there, you'll go into that enrollment, which is where you will do the CAS-related assessments, which we're going to talk about in a minute. Okay, I know that was a lot. So hold on to that. We'll come back to a lot of that. Let's go a little bit slower and talk about how having the CAS agency changes the experience of understanding the history of what our clients are doing. So let's go to the next slide. Okay. So in the past, before we set this CAS agency up, and before we really developed the CAS assessor, this new version of what it means to be a CAS assessor, this is what a client record would look like for your client, okay? One of the main things we look at when we're reviewing a client record is the history of their program enrollments. It's a timeline that shows an example of the client's record in HMIS. So you're seeing here, they've got 4 different programs. Some of the enrollments overlap. For instance, they're in a rapid rehousing program and they're also in an emergency shelter. Sometimes they don't overlap. But in order to see the real history of this client's experiences and homelessness through this period of time, this year and a bit, you would have to go into each and every single one of these enrollments to understand what had been happening with that client. And that's, unfortunately, that makes it really hard to understand the client's chronicity and to really know what's been going on with them, especially related to referrals and being able to access shelter and housing. So if we go to the next slide, let's see what happens now that we've developed a CAS agency. So as you can see now, there's another program enrollment, and that's the program I mentioned a second ago. Within the CAS agency, there is a separate program. And with this enrollment, they get enrolled when they first start working with someone. So the people they were working with at the rapid rehousing program enrollment enrolled them in the CAS agency program. And now that they're in that program, all of the referrals, all of the housing referrals, the shelter referrals, all of your current living situations, all those things are happening in one place. And that allows us to track not just their chronicity, but the success or lack of success of housing or shelter placements, and really gives a much better view of what's happening with that client so that we can understand the most successful approaches, and understand what's not working very well. So in each of these different programs, the direct service providers who are CAS assessors are entering information into both their program and into the CAS agency program. So let's say you work for the emergency shelter. When you're working with that client, you're putting your notes and the services you're providing from the shelter in your shelter enrollment. And if you do a referral for housing, you hop into their CAS agency program and you put those referrals in there. So you're working in two separate programs, your own and the CAS agency program. Hopefully that kind of helped clear up the difference between what we used to do and what we're doing now. So let's go ahead and go to the next slide. All right. So we're going to get deeper into these assessments and the coordinated entry events, all of these, which may be familiar to you or they may be brand new. This section is designed to just briefly introduce you to these main assessments. You're likely going to have a lot of questions about this material. Again, please remember to use that Q&A feature. And I will mention this multiple times, but there are many training resources available to you on the website, especially job aids, that will help you walk through these processes. So when you're ready to put this training into practice, you have a lot of support that is available to you. Okay, next slide, please. So in this section of the training, we'll be briefly discussing these 4 assessments: the current living situation assessment, the crisis assessment, the housing conversation tool, which is also an assessment, and the individualized support plan, which is also under assessments. So they're all for a little bit different things, but they all fall under the assessment section. So let's go to the next slide. Okay, so the CAS related assessments. As you can see, all of the assessments we're talking about today are available here in the CAS Agency Program enrollment. So in this image, we're in the enrollment and we're under assessments, and you see they're all sitting right here. The assessments with the green background are used to document changes in the client situation. In addition to the current living situation, which is an assessment that you should all be familiar with as HMIS end users, we also have the status and update and the annual assessments. These are regular common assessments that are in all programs where we need to update, whether we're updating where someone's living or we're documenting changes in maybe their income or their disability status or their insurance. And then annually, we always, if a client's in a program for more than a year, we always have an annual assessment to just verify that everything has stayed the same. The custom assessments we've created are all with a blue background. And while the individualized support plan is not unique to the CAS process, the rest of these are CAS assessments and will only be available here in this agency. To state it differently, you will only be able to complete the case conferencing tool, the crisis assessment, and the housing conversation tool from within the CAS agency. And only CAS assessors have access to the CAS agency. So that's why you're doing all this training, is so you can have access to this agency and access to the ability to complete these assessments, which will then allow your clients to get into the CAS process. All right, let's go to the next slide, and talk about the current living situation assessment. So we call it the CLS. It's a simple but incredibly important assessment that allows us to track the physical location of clients. The CLS always includes the date of contact, the client's current living situation, which is populated with that common list of options, including place not meant for human habitation or emergency shelter, and the location details of exactly where the client is. We've created a comprehensive step-by-step job aid to assist you in completing the CLS. You will find this valuable resource with the rest of them on the HMIS Job Aids webpage. So we really want to reiterate and ask that you use this incredibly helpful tool. We designed it with a lot of feedback. We know that it's definitely what you need to make sure you're able to do the crisis assessment or the current living situation assessment correctly. As you move through the questions in the CLS, clarifying questions can pop up depending on your answers. For example, if you say that the client's current living situation is a hospital or other non-residential mental facility, you would then be asked, is the client going to have to leave their current living situation within 14 days? So other questions can pop up to just get clarification based on what you ask. There's also a new living situation verified by question, which only appears when you fill out a CLS under the CAS agency. It is a bit of a complicated question. It was not designed by us and we can't adjust it. It's really just to identify who is providing this information. So if you're in the CAS agency, along with all the other people and all the other organizations across Sacramento who have CAS assessors, we need to know who's filling it out. And so you're able to then pick your specific agency and the program your client is working in for you to help us know which program the CLS is connected to. As I said, it's a little complicated. That's why the job aid has very clear directions and visuals and step-by-step shots and screenshots to show you exactly how to go through this list so you can identify your program and put the answer in there correctly. As you can see at the bottom of the slide, the CLS needs to be completed quite often. CAS assessor should be completing this assessment when the client is enrolled in a new program, after any of the CAS assessments, after logging a coordinated entry event, which we'll talk about a little bit later, and as soon as the client's location changes, even if it's a small move, like when they move the encampment down and they move a few blocks down from where they were sleeping. We want to see where people are and we want to see how often they're moving. And the repeated use of CLSs will provide us with a lot of data, not just about your client, but about all of the clients and how they're being asked to move around. And right now, that information, I think, is more valuable than ever. So it's really important that you complete these. They're quite easy to do if the information is basically the same or you're making a small adjustment. It doesn't take very long, but they're very, very important. The last line here is that the CLS needs to be completed, excuse me, if the previous CLS is over 30 days old. So if the client is in a program, sorry, there's an exception to that rule. If the client is in a shelter or a transitional housing program, if the nature of the program is to say the client is specifically in this place, then you don't need to fill it out every 30 days. We know where the client is. However, if your client is in a rapid rehousing program, you're doing a supportive services program, any program where they're not specifically staying in your program in a physical space, then you do need to do those CLSs every 30 days and anytime anything changes and anytime you fill out a new CAS assessment. So I know it's a lot of times, we definitely have gotten a lot of feedback about that, but the CLS is really, really important for us to collect the right data. So one more slide on the CLS. We're going to give you a little bit more information about the location area. So when you complete it, there is a button that says add location. This is a required field from the assessment. And when you click on the button, it will open the same location screen that you see on the regular global taskbar location tab. So this shouldn't be new information to you. You should have seen this screen before. It's not very complicated. It kind of looks like Google Maps. But what you want to do is either input an address or use the map itself and the little pointer on the map to identify exactly where the client is. So documenting exactly where the client is living is a really important part of this CAS process. I'll say again, because this has come up, it's been a really important piece to what we've been adding to this most recent version of the CAS Assessor training. We need to make sure that CAS assessors are completing CLSs every time they do an assessment, every time they update the ISP, you log a CE event, anything changes. We really need to know where folks are. And when you aren't putting in where people are, it can jeopardize their homeless chronicity. If we can't prove that we know they've been homeless for a period of time and it reaches the proper amount of time for homeless to be chronically homeless, then we're not able to show that proof. And without that proof, they lose access to programs specifically for people who are chronically homeless, which is a HUD-defined term. There's specific rules that HUD has on what that means. And also there's some shelters and some housing that are only available to people in certain zip codes. Shelters that are trying to house the people that are right around the area of the physical area of the shelter. And so if you're not documenting where that client is, then they may be losing access to some shelter and housing opportunities. I know I'm just drilling this into you guys, but it's been very clear. Everyone is asking. We really want to make sure that you guys understand how important these CLSs are. So they're simple, but important. So I will stop going on and on about those. I think you understand now how important they are. So let's go to the next assessment, the crisis assessment. Okay. So we see that little flag again. We know that this is important info. The crisis assessment has been created to replace all of the shelter referral assessments. You will use this same assessment to refer all of your clients to the shelter community queue, regardless of their homeless status or their household type. It's, also being used to determine PSAP eligibility or refer your client to a case management program through CAN, as all of the questions from those assessments have been integrated here as well. As with the CLS, we have a very comprehensive job aid with detailed directions and step-by-step directions on exactly how to fill this out. And I'm sure you already know, every time you complete a crisis assessment, you need to do a CLS. Okay, let's jump to the next one. The Housing Conversation Tool, or HCT. The Housing Conversation Tool was carefully and meticulously designed as a replacement for the VI-SPDAT and all other housing assessment tools, which includes the Foster Youth to Independence and LEAP assessments. So if you've been in HMIS for a while, you may be familiar with the FYI or the LEAP assessments, all of that. And all of the VI-SPDAT, all of it together were combined and brought into this one housing conversation tool. You will use this assessment to refer your clients for housing. It has a lot of great questions to get a real clear understanding of what your clients want, what they need, and all of that extra information will help the CAS referral specialist to figure out the best fit to finding them if they're able to find a housing opportunity that will work for your client, the right kind of housing opportunity, which could include things like if your client's in a wheelchair, we need to make sure that wherever it is we're connecting them to doesn't have a bunch of stairs. It can be simple logistical things like that, as well as things that your clients want, situations your clients are going through. So a lot of really good information can come from accurately completing the housing conversation tool. Right, I think that's it. Yep, similar to the crisis assessment, it was designed so you can use the assessment regardless of the client's homelessness status or household type. So it's good for individuals, families with adults only, families with children, all of it. Every time you complete the HCT for a client, you'll need to take some additional steps. You either need to create or update the client's ISP, that's their individualized support plan. We'll talk about that in a minute. You need to log an appropriate coordinated entry event, which we'll talk about in a minute. And not surprisingly, you need to complete a CLS. All right, let's talk about that individualized support plan. So this is the individualized support plan, or ISP. The ISP is a template for creating a detailed plan with your clear, achievable, and measurable goals. Quinn will go into much more depth about this assessment in the second section of this training today. And as I mentioned in the last slide, you will either create or update the client's individualized support plan every time you complete the housing conversation tool. However, we expect the CAS assessors will be updating the individualized support plan on a much more regular basis. This plan is there for you to be able to work closely with your client to help both create a long-term plan and also pivot based on the changes that happen and reassess where they're at to support them in moving towards their housing goals. As with the housing conversation tool, following the creation or update of any individualized support plan, you must complete a CLS and then log the appropriate coordinated entry event, which we are finally going to talk about next. So next slide, please. Coordinated entry events. This is a new feature and it's not available in any of the other programs that we've ever had. So this will be brand new to you. However, they're not super complicated. Coordinated entry events, or CE events, are used to log major milestones in the client's CAS CAS program enrollment, and are vital to tracking the client's progress through the coordinated access system. Logging a CE event is very similar to logging a service. In the client's program taskbar under the Events tab, as you can see, we're in the program enrollment in this picture. We go to the Events tab, and they're all sitting right there looking just like services. As I mentioned previously, a CE event must be logged after the completion of a housing conversation tool and or the creation or update of the client's individualized support plan. The CE event you want to log for these two assessments is titled the problem solving / diversion / rapid resolution intervention or service CE event. To be clear, the HMIS staff didn't name these, and we can't change the names. If we could, I promise we would have given you an easier title. Please note that if you're creating or updating the client's ISP following the completion of an HCT, so if you do both of them, you only have to log it once. So at least it's not that persnickety. There's also CE events for referrals to homeless prevention programs, street outreach programs, and other programs that provide housing services or emergency services. In each of these cases, if you were referring someone to a street outreach program that you're working with, we would expect you to be providing a warm handoff referral to one of these programs. So that would mean referring the client to the program where you or one of your colleagues has contacted the program, connected the client directly with the staff at the program, and verified that they can be enrolled. Simply giving the client a contact information for a program or a list of local resources is not considered a warm handoff and should not be logged as a CE event. We're expecting you to take the extra time to make sure that the client can connect to the right person there and that that person is ready and willing to take them and enroll them in their program. So these are not necessarily things you're even doing in HMIS. This can be something you're doing in your own workplace. But when you do that, you're going to come into HMIS after you've made that phone call or talked to a colleague in another program. You're going to come into HMIS and you're going to log this coordinated entry event. Okay. Yep, I think that's that for this slide. I apologize. So let's go to the next slide. All right, the last slide in this section is just to mention the history tab. So once you've done all of these assessments, or other CAS assessors have done these assessments, where can you find everything? Well, in the history tab, of course, that's on the global taskbar. At the top of the client's record, before you're in any program enrollment, you can always go to the history tab. And this tab is a fantastic resource for looking at everything going on with the client from every program they've been enrolled in the past and present. It includes their enrollments, services, assessments, referrals, reservations, CE events, all of it. Yep, sorry. I jumped away from my notes for a second. So while the entries have some basic information, including underneath them, the agency that is connected to this referral or this service, you can get a lot more if you go to the left of the image or left of the wording and either click on the edit button or the eyeball so you can read more about what's happening. There's also a search feature, which this image has open, which allows you to filter the results, which makes this tab a lot easier to use, especially if the client's been in multiple programs for many, many years. You can filter it to see only assessments or referrals. You can filter to see only things that are listed, only instances that are listed under the CAS agency. You can do a lot of filtering, which is great. Also, the entries are color-coded. So enrollments are yellow, services, which is that one on the very bottom, the fourth one, it comes up in white. Assessments are green, reservations are red, referrals are blue, and CE events are orange. So you'll start to get a feel for what you're looking for, and the colors will make it a lot easier for you to identify exactly the information you're looking for. So if you've lost an assessment you've completed or you're looking to see if someone else has done one, this is the best place to go. And I will note there's that little orange flag right there. So this may or may not be a question. All right. So next we're going to do a little pop quiz. If we can go to the next slide, please. All right, pop quiz. Here we go. You're going to drop this in the chat for us. They're simple true false questions. What I want to see is 1, true or false, 2, true or false, 3, true or false. Just give us your answers real quick. And we'll see how y'all do. 2 of these questions we've just talked about, but one of them is from yesterday. Sorry, not yesterday, last week's training. So let's see how you guys do.
All right. Answers are coming in. Great. Kai, it seems like the majority of folks have answered false to number 1. Would you say that's accurate?
That is correct, and that it is incorrect. The answer is false. You should not skip questions, and you should not add information. You want to read them as they're written, but you do want to feel free to talk to the client and make sure they understand. You just want to make sure you read them as they're written. They've been carefully written to make sure that they are as equitable and clear as possible.
So for clarity, it is not okay to skip completing the location.
Oh, I'm so sorry. I gave the wrong one.
It's really okay.
Yeah. Okay, so no, it's never okay to skip the CLS. I think if I haven't drilled that into you guys yet, I don't know what to tell you. So never okay. And now I've given away number 2. So
well, that's why we're here, right? To learn.
Yep.
All right.
Yep.
So number 2, you are responsible for asking the questions exactly as they are. Thanks, Candace. Great job. Alicia, you got it. Yep. And let's talk about number 3. True or false?
Well, I'm seeing some good answers. The answer is false. It's not on the assessment tab in the global taskbar. It's on the history tab.
Yes, Tiffany nailed it.
Maybe a small thing, but it's on the history tab. That's where you want to go.
Good job, Tiffany. Thank you. Yes, Sherry, you got it as well. Thanks, everybody. Excellent.
Yep. Trick question, just a little bit.
Just a little bit. And a heads up, y'all, these are questions that came right off of the certification quiz. Yay. All right.
So let's go to my last little section for you, which is not filled with as much information for you to absorb, but it's all about how we're going to be able to help you. So support and training resources. And I'm going to say one more time, make sure you put your questions in the Q&A. We're looking forward to answering those. So next slide. HMIS job aids. I know I keep saying the same thing again and again, but our job aids are amazing. And the staff and I that create them, we work really hard to make sure that they are a good resource for you. We have tons of them, but there is specifically a whole section on coordinated access system related job aids. So you all know working in HMIS can be complicated. If you don't do these things very often, it's really easy to forget the little steps, the little nuances. So please utilize these resources. They're available on our website. We will definitely be giving you links. They're very easy to find, and we are always creating new ones and updating them. Next slide, please. Additionally, the CAS team created a CAS Assessor Best Practice Guide, which is a fantastic resource, providing you with direction and detailed information about all the work you're doing as a CAS assessor. So a wonderful, excellent, another wonderful resource that you should definitely be taking advantage of. Also available on our website. Next slide, please. And we're going to click that so all of it is showing. Thank you. Okay. So we know that there will be times where you will need assistance, and SSF staff are always happy to help you with this. We would much rather you ask for help than guess and have it not work out right and have to go back and make some adjustments. So we are more than happy to provide additional support, and we have many ways we offer that. However, it is important to know that there's different teams at SSF that do different things. And we want to make sure you can identify who you need to get help from to make sure that you're getting help as quickly as possibly. as quickly as possible. Sorry. So to keep things straight, here's the real quick version. To remember, the CAS team facilitates the entire CAS process. Why things work a certain way, how they're going to work, what's going on with eligibility, where is someone on a list, which, what list, where, all that kind of stuff. Which CAS assessment should you complete? Why did your client get that score? How did you complete it correctly? All of that. You want to go to the CAS assessment or the coordinated access department. It's the CAS folks that do that stuff. Myself, I and my team, we are the HMIS team. We are the system administrators for our HMIS, our Homeless Management Information System. Our job is to provide technical support for utilizing the system. So if you want to know where the assessments are, how do you enroll a client in a program? How do you complete the assessment? Where do you go to log in? Why are you having trouble finding the agency? Things like that. Why are you having trouble engaging the system to get it to do what you want it to do? That's when you're going to come to us. So this is the separation, and we really encourage you to think carefully about what it is you need to know so you can direct your question to the right group of people who can answer you quickly and accurately with no confusion at all. So let's go to the next slide. So to get help from the CAS team, there's a few opportunities here. The CAS housing team has a housing referral open office hours time from 2:30 to 3:30 on Mondays. And you can also email them directly at referrals@sacstepsforward.org. The CAS shelter team and the CAN team also have a separate email. That's cas@sacstepsforward.org. And there is a specific team that works with survivors and victims of domestic violence and sex trafficking. The CAS Survivors Access System is scas@sacstepsforward.org. And if you have questions about being a victim service provider and anything about the upcoming, hopefully soon to be offered victim service provider database, all of those questions can go through SCAS. And lastly, the next slide for our stuff. Here's our stuff. We have open office hours every Wednesday from 12 to 2 p.m. for 2 hours. There's always staff available in there. The links to those Zoom meetings are all over the web pages for HMIS. Also, we highly recommend that you email us at hmis@sacstepsforward.org. We have a ticketing system. When it comes in, we will triage the ticket and identify the right person on the team who's working with that project or who could best answer your question, and we'll direct it to them. We're able to track all the information that comes in. So these are excellent ways to get in touch with us. And emailing us is the best way to get in touch with us because we all have our eyeballs on the ticketing system. We also have an email address for our newsletter. So if you're not getting our newsletter and you'd like to, it's hmisnewsletter@sacstepsforward.org, and we're more than happy to help you get set up. So now we have question time. So let's start looking at those questions and see what we've got.
There was one in the Q&A about the color coding guy
Okay.
and the history screen.
Yes. Okay. I only see one open. Can you tell me more about the question?
It was from Indiana, the color coding of entries in the history tab. Is there a key for the color coding in the website? If not, can you review the
There's
color
not a
coding?
key. There's not a key. I actually had to go figure it out myself. But what I did figure it out, and you're right, a key would be a great idea. What I did to figure it out was I filtered for referrals and then noticed that all the ones that came up were one color. And then I filtered for services and noticed all the other ones that came up was for that color. So honestly, before the training, I'd always knew it was color coded, but I hadn't quite figured it out. So I think adding something like that would be a great idea, as I am in the process of currently redeveloping all of our HMIS training from the ground up. I would definitely like to add that in. So thanks for that idea. You'll definitely, as you filter that search feature is pretty fantastic. So I highly recommend playing with the search feature a little bit. You'll be able to find what you need. And if all else fails, email HMIS. I do see a question from Deshaun. What is the turnaround time for our ticketing system? That's a really good question. I think right now we're able to get back to you. I think we offer 24 to 48 hours. But we're sitting it all day. So Lizette is our new administrator, and she coordinates and manages all the tickets. So this is everybody. Everybody asks for, I need HMIS access. Can't get in because I have problems with my password. Like any of you who've been in HMIS who've ever needed to email us to get access to a new agency, or why can't I find this thing, or how can I find that thing, all of that comes directly through. And so anytime you have a question about CAS assessment or anything else in HMIS, shoot us an email and we will get back to you as soon as possible. It is the best and easiest way to get a hold of us. Absolutely.
Kai,
Uh,
thank you. Thank you
yeah,
so much. If you have just like any other questions that you want to answer live, I do want to make sure that we give our trainees a little bit of a bio break. So I see one other question here, Tanya.
yeah.
Are the office hours coming back?
So Tanya, I don't think office hours ever left. I'm not sure what you mean, but our Wednesday office hours from 12 to 2 are there every week. There's somebody in there every week. We have on occasion we do have an extra hour from 2 to 3 that we will sometimes utilize for specific things. For instance, if we're running the LSA and we're needing you to get back to us on that, or if we're working on cleaning up some kind of data entry issue, we may offer to say, hey, if you need help with this additional thing, we'll be available from 2 to 3, but we are always available 12 to 2 every Wednesday, rain or shine. Ronnie, you know what? I'll type the answer. I think we're good for the verbal stuff. So everyone enjoy your break.
Thanks, Kai. We will return at 10:47 to be specific, so you can all have 5 minutes. We'll be back. All right, while we're waiting on Quinn,
Oh shoot. I wasn't sure. I couldn't hear anything, so sorry.
that's okay. I was ready to jump in and deliver the training,
Okay.
Quinn. I got
No
your back,
worries. Thank you.
of course.
All righty, so we're going to do introduction to individualized service plans, planning. And so the three things that we're kind of going to cover is understand how to interpret CAS assessment results and develop client-oriented or centered individualized support plans, then learn how to discuss housing and service options using a human-centered and trauma-informed approach, demonstrate how to elevate extremely vulnerable households, EVH, for immediate assistance. Next slide, please. So developing and the ISP. So an individualized support plan. All CAS assessors must complete this after finishing the HCT, the Housing Conversation Tool. And then the HCT will inform the development of the ISP with trauma-informed care practices. Development should be led by the client. And so one of the reasonings why we have CAS assessors do an ISP afterwards, after an HCT, is because we don't want it to just be an assessment. We want it to be a conversation, but we also want it to build towards development towards a client achieving their goals. And so part of it is the assessment, which is like the referral component, and then the ISP, the individualized support plan, is really about what are the steps that are going to take to help the client achieve their housing focus goals. And so the next one is ISP is not static and can be updated. Unlike the crisis assessment and the HCT, the housing conversation tool, you can go back and update ISPs and provide just different information, and it's a continuous process. And so, unlike the ISP, which is really used for a referral tool to determine eligibility and vulnerability and any other housing barriers, this is really about the steps that are going to take to get your client ready for a housing program. And then lastly, doc readiness updates should be shared by the case conferencing and referral tool. So the ISP does not actually replace the case conferencing and referral tool. You still have to do those separately. But if you do help, but a housing goal, an ISP can be used to start getting a client doc ready. So if after an HCT, you realize, okay, a client needs certain documents, that can be part of the stated goals for an ISP. Next slide, please. And oops. So the ISP key components, this is for the housing conversation tool interpretation and direction. So after you do the HCT and while you do the ISP, you will also talk to the client and understand where is the client reasonably eligible for, and what are the needs that the client needs to be addressed once they get into a housing program. And so it's also about just helping you as an assessor. It's another tool for you, the assessor, to understand what are the next steps going to take after an assessment. Client-led process. So part of the trauma-informed care process is just having your client involved. Like it's not supposed to be about the goal that you're doing for your client, but it is about setting up goals to do with your client and you helping support. And so the client should be well informed of the next step, any updates, and be engaged in the process. And then assembling a support team. There's going to be a couple different folks who are going to be helping you do this. There's going to be the case management, which is part of what you're doing, but also there could be a certified social worker as well who's also helping out. Housing navigation, if there's a housing navigation within your organization, or if you guys have a connection to a housing navigator who's able to help your client out, that could be also included as part of the support team. And then healthcare, including behavioral health. Those teams, if your client has mental health or physical healthcare needs, you can also include members, direct contacts, points of contacts who as part of the support team. And then housing focused SMART goals. And so SMART is an acronym for specific, measurable, achievable, and relevant and time bound. And later on, I'm going to go over some examples, but they're going to meet those. When we set up an ISP, those are the kind of the 5 keys that we should really think of when we start to develop goals for each individual client. Is because each client's going to have very different needs and very different issues that they're going to have that are going to help them get into the housing and in their housing crisis. And so being able to just have that kind of clarity with the SMART model will help guide your development of goals. Next slide, please. So the trauma-informed care approach, Trauma-informed care is a manner of interacting with clients with the assumption that they have experienced trauma. This ensures that every interaction is rooted in humanity, emphasizing safety, empathy, and respect while fostering a supportive and healing environment using the 6 pillars below. So the 6 pillars of trauma-informed care is safety, transparency, trustworthiness, peer support, collaboration, empowerment, and cultural humility. Next slide, please. So here's an example of an individualized support plan. So this is Jane Doe, and the goal is to secure permanent housing. And so the first goal specific is Jane will apply for and secure permanent housing within the next 90 days. And so measurable, Jane will complete at least 3 housing applications and schedule at least 2 viewings per week. Again, so this one is specific. When we start with this is we're going to try to secure permanent housing within 90 days. Measurable is building in the routine of filling out applications and um, viewing properties, because that will, especially if your client has been in a housing crisis for a long time, this will build up their confidence in talking to landowners, landlords, and all that, and they will be able to actually build a rapport as well as with your support. But even if they just do it by themselves, they will have the routine of applying for different applications. Achievable. Jane will work with a housing navigator to identify suitable housing options and complete applications. And so, not that this all falls on you, but if you find a housing navigator to work with your client, you guys can all kind of work in tandem to helping her achieve her goals and helping identify. Relevant. Why is this relevant to Jane? Finding permanent housing is crucial for Jane's stability and long-term well-being. And then time-bound, this kind of emphasizes that we will try to find Jane permanent housing in 90 days. So the next is action steps. So action steps is in the first 2 weeks, we'll try to meet up with a housing navigator to review options and to just prepare application documents. That includes just kind of gathering any type of documents that a landlord would need or a housing program would need. Weeks 3 to 4, submit applications for identified housing units. Weeks 5 to 6, attend housing viewings and follow up on applications. Again, it's not it's not always easy to just go and view, but also doing the follow-up work and understanding that, your client might be told no a lot, but it's about keeping the perseverance and keeping going, keeping them engaged. Weeks 7 to 8, review and respond to housing offers. And then weeks 9 to 10, finalize these lease agreements and move into permanent housing. And so while this looks ideal, this isn't going to fit every single client, but this is kind of the basics of setting up. And so we have another example. And so this is about addressing her healthcare needs. And so while these 2 examples aren't necessarily set up to just focus just on housing, but they are about developing skills and developing the rapport and the framework to get into housing. And so Jane will establish a regular healthcare plan and address any immediate medical needs. And then measurable, Jane will schedule and attend at least 1 healthcare appointment per month. Achievable, Jane will connect with the healthcare plan team to access necessary services. And then relevant, Addressing healthcare needs is vital for Jane's overall stability and ability to maintain housing. And then time bound, Jane will have a healthcare plan in place within 60 days. And so going over just action steps, weeks 1 to 2, Jane meets with the healthcare plan and creates a care plan. 3 to 4, schedules the necessary medical appointments. Weeks 5 to 7, attend schedule appointments and follow up with care providers as needed. And then weeks 9 to 12, review and adjust healthcare plan based on feedback from providers. Thank you. And so this other one is about improving just financial stability. And so the first goal is create a budget with Jane and work towards increasing her income through employment or benefits. Measurable is developing a budget and apply for at least 2 job opportunities or income support programs. Achievable, Jane will receive assistance from a financial coach and job placement specialist. Relevant, financial stability is essential for maintaining housing and meeting other needs. Time bound, Jane will achieve this goal within 120 days. And so for the action steps, weeks 1 to 2, work with financial coach to create a budget and set financial goals. Weeks 3 to 4, update resume and apply for job opportunities. Weeks 5 to 8, attend job interviews and explore additional income supports. Weeks 9 to 12, secure employment and week benefits and adjust budget as needed. And so this is really about, helping a client when they get into, thank you, helping a client when, before they get into housing or simultaneously while they're waiting to get into housing, just building in and helping them develop those supportive skills that are going to help them continue to move forward and away from their housing crisis. And so now we'll go to the EVH, the extremely vulnerable households. So the extremely vulnerable household, EVH policy, prioritizes households for the next available and appropriate shelter unit. EVH clients will be prioritized for housing supports as well. And so EVH is defined as individuals scoring 6+ on the HCT or crisis assessment, and that's adults only. And then families as kind of defined as we define it as one adult, at least one adult and at least one minor, scoring 10+ on the HCT or the crisis assessment. And so some key aspects of the EVH policy is that EVH clients can be escalated for immediate supports, including shelter and case management during their first engagement. EVH clients should be assisted with completing and uploading doc-ready requirements. And so one of the key things that we really want for CAS assessors to do is that once they realize, especially after they do an HCT assessment, once they realize that they have an EVH client, they should immediately start gathering the documents. Hopefully, before they do the assessment, they would review to know what documents are needing to be updated. And I believe in the next week or so, we will have a training on doc readiness. And then one other key aspect of the EVH is that it creates an alignment between the shelter and housing prioritization. Clients prioritized for shelter are prioritized for housing and vice versa. And so, yeah. Next slide, please. Factors of EVH. So for singles or adults only, it is escaping DV, escaping any type of human trafficking or anything like that, pregnant, a disabling condition, seniors over 55, a recent mental health crisis, a recent physical health crisis, sleeping in a tent or outdoors, or being continuously homeless for over a year. And then for families, it is families with multiple children, at least one child under the age of 5, single parent households, or the presence of multiple factors in the other column. So for the singles, if there's multiple factors going on in with a client, with a family, those would also be considered. Next slide, please. And so this is the crisis staff. This is a chart of how the EVH clients are going to be prioritized. And so the crisis staff will review the client's eligibility and determine if a same-day shelter can be made. That will usually be from 211 if there's a shelter available. If client is unable to be placed into an emergency shelter, the crisis referral staff will explore alternative options until an intake can be scheduled. Once a client is connected to an emergency shelter, case management staff will support with getting client doc ready for housing. EVH client will be prioritized for COC options such as rapid rehousing and permanent supportive housing. And so I wanted to also just have you guys focus on just the EVH backline, which is open Monday through Friday, and the phone number is a direct line to 211 operators. I wanted to also just quickly emphasize that the backline is used mainly for clients who have already been identified as EVH and not about inquiries. If you have a question about if a client should be EVH or should not be EVH, it should be directed to CAS or the HMIS team. Next slide, please. Alrighty. Did anyone have any questions about the ISP tool or the process?
Hi, Quinn. We've got a nice long question
Okay.
in the Q&A. Is it at all possible to expedite the certification process for CAS assessors? We very recently lost 2 case managers, leaving only myself and the shelter supervisor bogged down with our existing caseload. And now all the additional clients we have had to absorb from the 2 case managers that are no longer with our organization. A majority of the clients are doc ready or are nearly doc ready and ready for case conferencing. They're sitting here waiting and waiting for the next step. But until I get certified, all of these clients are on the shelter supervisor's caseload, in addition to her responsibilities in running the shelter. Since these trainings are recorded and there have been previous cycles of these trainings, is it possible to watch the recording from the last cycle and then take the quiz ahead of the next CAS training session in June? The CAS system was implemented during the 2 years it was not working, but prior to that, I did many case conferences with CE. That was a long question. I'll let you answer that.
So I assume that this is from someone in a shelter, and that we do want folks to attend the entire training series. And I do understand that, we are trying to do these regularly, at least once a quarter, just to ensure that we catch everyone. And so, yeah, it wouldn't necessarily be fair to kind of make a decision, based off of an individual organization's need. If you do need like additional support, just on getting assessments done, getting clients referred. Because that's what it seems like. Seems like you have a lot of clients who are ready to get into some type of housing program, and it's just about getting the assessments and getting the referral process rolling. An option for you is to, and even though it's not fun to outsource that type of work, especially if you could do it. But you can also call the 211 line and have them do an HCT over the phone.
Thanks, Quinn.
Kai, you wanted to jump in?
You know, I was going to say exactly what you said. So, and the process, keep in mind, everyone, that in order to be a CAS assessor, you first have to be an HMIS end user. And that process also takes time, because being a CAS assessor is a heightened, like having an additional access that most HMIS end users do not have. So in order to be in HMIS at all, your organization needs to be in HMIS, all the documents need to have been signed, your supervisor needs to send information to have you added, then you need to complete your quiz and your stuff, all the pieces to get you into our homeless management information system, which is incredibly restrictive based on HUD and federal guidelines. Our system is very secure because, as you all know, we have a lot of data about our clients that we would never want out. We want to all protect our clients the best we can. So there are steps to get into the system and then additional steps to become a CAS assessor. But as Quinn said, there are roads for your clients to be able to get these assessments completed by utilizing the support of 211 staff until you're able to have your own staff leveled up so that they can assist. So I think beyond that, that's a bigger question. But there's lots of resources to support. And if all else fails, use those email addresses, come to open office hours, ask questions, and we can brainstorm with you, because we're all on the same page about doing what we can to make sure your clients get access to shelter opportunities and housing opportunities as fast as possible. So we're with you. Let us try to help and brainstorm, and we'll all figure it out together.
Thanks, Kai. I do want to also add, I think case conferencing would be really, really helpful in this situation. I see Deshaun, you raise your hand. And you've also added a couple of questions in our Q&A. And I would also refer your question to our case conferencing. And that information, I see the case conferencing is only available for HMIS users. And some of the folks on this training actually are already HMIS users. So not everybody here is brand new. So I do want to make sure that that's noted as well. Thanks, Kai. I think that we've got that.
We have one from Lauren. Lauren asks, do we as assessors determine who is EVH, or is it assessment scores that automatically decide it? And so for EVH, if, after you're done with the assessment, it'll have like an eligibility tab, and then there'll be a vulnerability score. That vulnerability score is what determines if the clients are EVH. So there's like a bunch of scores that'll have like what shelters or which housing programs they're eligible for. I think it's like 100 or above, they're eligible. But then there's just a specific vulnerability score. And then that will be determining if they are. So if it's for individuals, it's 6. If it's a family, it is 10. And then, oh, sorry.
No, that's okay. Carry on.
I was just gonna say for Deshaun, your question, feel free. I don't know if I think Kai might have answered this, but or someone might have. But if you do need more support, just feel free to ask. We would need more specifics about what type of support you would really need, and we would we may be able to support you, or we may be able to redirect you who would be able to help you out. So yeah, please feel free to reach out to HMIS or the CAS email, and we will try to help you out as best as we can.
I'm going to also jump in here. We have a few more trainings coming up that I want to remind everybody. So some of the content that was brought up in today's training, you might be like, but how do I do that? Right? The next training is document readiness and what happens after you have completed some of these assessments within HMIS. I think that training will kind of fill in some more blanks for some of you. We then have a week off, and then the following week, Quinn and I will be talking about trauma-informed care practices, as well as vicarious trauma, understanding it and how to prevent it, as well as compassion fatigue and burnout. And then the final training in this series will be our introduction to conversational case management. And that really helps us with the ISP, right? While Quinn was like reading how we do this, and I thought to myself, I've been in the seat of a direct service provider. If I had been sitting in this training and I was like, but how do I do that? Right? The conversational case management training is wonderful. We include a lot of motivational interviewing skills and practices in that. So I think that will also fill in some gaps for you as well. And then, of course, we have the in-person housing problem solving training, which talks about diversion, rehousing, and prevention strategies. So I think together, all of this information really kind of fills in the blanks that some of you may be like, how do I do that? How? All right. Yeah, I wanted to make sure that you knew that that was coming up as well. And I see there's 2 more questions in the Q&A, so I'll be quiet and let you 2 gentlemen manage that. Thank you.
This one, so Robert, hey Robert, is there somewhere we can check our progress in training, which courses we have completed? And I've had my work conflicts to make all the trainings. I believe for that you can probably do the trainings email or the HMIS, because they're the ones who would have, if you are granted.
Kai's like, don't send them to me. Kai, you're on mute. Kai wins. Somebody was going to do it this turn.
I got them muted. That's most likely going to be Jody. So we can tell you about HMIS access, but CAS training, I wouldn't know what you've done and what you haven't done, Robert.
Sure, Robert. You can just send an email to training@sacsstepsforward.org. Thank you. I saw Kai like the smoke coming out. Like, oh no.
And I think, Robert, you're probably not going to have to do another training till October. I think you were certified last year. But
wonderful.
Thank you.
Yeah.
Yeah, go ahead.
I'm gonna field this question. Is there a training for a complete walkthrough of the assessments? And I have gotten this feedback since I've been here, just about 18 months with SSF. For our visual learners, they want to see from like start to finish. And it's definitely on my list. And I also know that we're a capacity as an organization, and that there are so many variables in each assessment that this is going to take some effort and planning, and it's definitely top of my list as an addition for 26. And Kai, I see your hand up. I'm sure you got some insight on that as well.
Absolutely. So Tiffany, my first question to you is, when you say walk through a complete intake, my question is, do you mean a program enrollment, just a general program enrollment, right? So that information would be in the job aids and things that HMIS team can help you with. If your question is about the assessment specifically, I would highly recommend you use those job aids to walk through, because we do walk you through each page and go through all the questions the best we can. And if you need one-on-one training, because as Jody said, we know that for a lot of people, watching it happen is one of the best ways to learn. That is where we would invite you to open office hours. So the point of open office hours is my team and I are sitting there waiting, just chilling, waiting. We don't have an agenda. We're just there. And you show up and say, hey, I'm trying to do a current living situation, or I'm trying to do a crisis assessment, and I'm getting confused, and I just want to look over it with you. And we can take the time. That is the time for one-on-one, real-time, totally fabulous engagement. We sit together and walk through and answer all your questions. It's going to be the best one-on-one time you can get. And that's why we carve out a full 2 hours for that, so it can meet people's deadlines, whatever they've got going on. If you've got a lunch in there, we don't want to just give you a 1 hour period. You have a 2 hour period every week. That is where you come to get us to walk you through the assessment. Now I can't tell you if we're back to that separation again, right? I can show you where the ISP is. I can show you what to click on, how to do the individualized service plan, whether you're doing it correctly as a CAS assessor. That's Quinn. I don't know exactly what it's supposed to look like as a CAS assessor. That's not me. But what I can tell you is where it is. So Tiffany, you're saying you just want a piece to come together, no videos, no training, it's just get in it, boots on the ground. There isn't a place for that. We all have the number of staff folks we've got. We've got a team for the HMIS team. We run 2 COCs and we have about 12,000 users. So at this point, we don't have the time or the capacity to break out trainers and have time where people can come in and just do everything at the same time. So unfortunately, the videos, the trainings, the job aids, these are all the training materials we were able to offer you to do this work, and open office hours for you to come and ask questions. We're doing our best to offer you what you need. And that's going to unfortunately be the best way. So a practice charter. Tiffany, we can raise any suggestions you have. We can always raise up the ladder to folks who are deciding, the budgets and the employee and the staff for different things. But like most of us, like a lot of us nonprofits, we're doing what we can with the resources we have, and we're doing our very best to provide you all the resources we can provide you. So I'll stop there. Quinn, you've got your hand up. I don't know.
And I think Tiffany, I'm not sure what program you're with, but if you do want some more in-person training, and just depending on how much time you're really needing, how many staff, it is possible that the CAS team can come out and just do like an individual one-off kind of walk through the assessments, how to walk through. So I think I can drop the CAS email and then in the chat, and then we can go from there. Thank you.
All right, Deshawn has a question about office hours. Is the expectation for office hours to have a long wait time, or is it just send a message and get a response? I want to make sure I understand that in the 2 hours I will submit a question, or will it be in real time?
Gotcha. Open office hours is a Zoom link. You're going to come into a Zoom room, and there will be people hanging out. Sometimes we sit in there for 20, 30 minutes, 40 minutes, and nobody shows up. Other days, we get 4 or 5 people who show up. So if we're answering a question for one person, you'd wait. Quite often, people come in with the same question, so you're listening to their question, you're learning something else. If we are really fielding a lot of folks, we do breakout rooms. And so if there's someone there that, we've got another staff member or someone's available, and we go, hey, you've shown up and we need someone in here to come in real quick and answer this question, we can. But it's just all a bunch of people in a room together. So it's not like a training. It's not, everyone's on their videos. We're all right there just sitting and answering questions. So it's the same as anytime you go drop into someone's office. They're available to answer questions for you. So yeah. And we look forward to having you.
I think the next question, how can housing referrals be sent if I am off on Mondays? Vanessa, it's my understanding that it's an open office hours on Mondays, that it's not the only time that you can send referrals. Is that accurate, gentlemen?
Yes.
Correct.
Thank you.
Yeah. I think that's just the office hours. That's on Monday. I think they're available pretty much Monday through Friday to handle referrals, housing referrals.
Wonderful. Thank you. There is one question that is left to be answered live from Christine. Christine, I'm glad you're here with us again. Thank you. What if your client does not want their exact location to be input because they're afraid of being swept? Quinn responded here that you can advise your client that law enforcement agencies do not have access to HMIS. I felt that was relevant to be shared live with everyone. So I just wanted to clear that. I like this question, Quinn. I think you can field this. Is there a flow chart from intake onward?
Possibly for the housing programs, there could be. Each housing programs, their intake processes and even shelters are kind of different. So we don't necessarily have like a standardized intake from onward on from intake on. I don't believe we have like a standard intake flow chart. Yeah.
Thanks, Quinn. Vita, it looks like you dropped a question on your email in the chat. Any follow-up actions for emails comes through the Q&A. So if you could just drop that into the Q&A, I'll make sure you get what you're requesting. Thank you. And how about from HMIS? I think that's the flow chart question. Is there a flow chart?
Yeah.
Yeah.
Yeah. So the flow chart question for HMIS. What's the best way to do this? So being a CAS assessor is a specific group of folks. Being people that are trying to utilize referral system to get into the CAS process as specific assessments. Not all HMIS users engage in this. Not all HMIS users are doing these CAS assessments. So a flow chart to be utilizing the assessments would most likely be something you would talk to CAS about, because they would be talking you through. HMIS is a huge system and there's a lot of things happening outside of the CAS assessor agency. So if you're looking for a flow chart on how to enroll a client, a flow chart and how to do assessments in general, those kinds of things, you're going to find that in our training materials, which I think I mentioned earlier, I'm redeveloping from the ground up right now. So as always, and I know I'm still saying the same thing, I wish I could offer you guys everything you want. I would love to do that. Let me get 4 more CAIs and we'll all work together and get it done. But in the meantime, emailing HMIS, utilizing our job aids, and then coming to visit us in open office hours, so that if you're asking specifically for what's the flow to get from here to there, somebody in a one-on-one could talk to you about your specific program. We run, some of you guys work for emergency shelters, and some of you work for permanent housing supportive programs, and some of you work for rapid rehousing, and some of you do outreach, right? And so every program is going to be a little different. Every funding source is going to be a little bit different. Every community you're serving is going to be a little bit different. So the question comes back to like, what exactly you're looking for, so that we can provide you that information. I know that I've seen requests for open office hour links. I'll say again, so our open office hour links for HMIS are on all of our HMIS pages at the bottom, and I included that link in the group chat a little bit ago. Quinn, if you can grab the link for the housing, you guys as open office hours, and throw that in the group chat, that would be great, and that way everyone has it. We have the links on the website specifically because if anything changes in that Zoom link, we would never want you going to some old Zoom link. Zoom links, they can change, things can happen. So what we like to tell everyone is just to go to our website. On the bottom of every single HMIS page, there's 2 big links, and it's right there. So if we do have to change the Zoom link, we can update it on the web page, and you will always be able to reach us. If all else fails, HMIS at sacstepsforward.org is the best way to get all the information you need from our HMIS department.
Thank you. Thank you, Kai.
Absolutely.
Thank you, Quinn. It is 11:30. We have cleared out all the questions. As I said before, thank you so much for sharing this morning with us to get through all of this really helpful content. Please be sure to complete the training survey on your way out. It'll pop up as soon as you exit our Zoom. And we will see you next week. Yeah, next week is document readiness. And we will get to hear from our CAS referral specialist. And as always, we've dropped a couple of the emails in the chat if you have additional questions. I want to thank you all for the work that you do. I know each of us on this training with SSF holds you in a really special place, knowing that you get to be on the front line with each person. We value you. I'm speaking for the gentleman on the call. I'll say it. I hold you in with the greatest esteem and appreciation and a deep, deep gratitude. I know this work is not easy. So thank you very much for what you do. And we'll see you next time. Thanks, gentlemen. Appreciate your expertise.